Welcome to my channel. This is Dr. Rashid. Today we will discuss about candidiasis. Candidiasis is a fungal infection caused by an overgrowth of a type of yeast that lives on our body. A candidiasis infection often appears on your skin, vagina or mouth, where candida naturally lives in small amounts. Healthy bacteria on our body prevent yeast overgrowth. What type of candidiasis are there? Since yeast naturally lives in our body, there are different types of candidiasis based on the location of the infection. Types of candidiasis include vaginal candidiasis or vaginitis, a common infection that causes burning, itching, redness and discharge from your vagina. Cutaneous candidiasis, an infection on our skin that creates a raised red patch with small itchy bumps that forms in folds of your skin, like in your underarms, under your breast and near your buttocks or groin. Oral candidiasis or thrush, an infection that causes with sores in your mouth, throat, esophagus or tongue. Candida granuloma, a severe chronic infection that targets our skin, scalp, mouth or fingernails. Invasive candidiasis or systemic candidiasis, a serious infection that occurs throughout our body, often in our bloodstream or on the membrane lining of our heart or skull as a result of an immune deficiency. Who does candidiasis affect? Candidiasis could affect anyone because yeast naturally lives in our bodies and it's easy to disrupt the balance of yeast and healthy bacteria. Candidiasis can affect both healthy people and those who are immunocompromised. Candidiasis most often affects people with diabetes, people who are pregnant, babies and infants, people who wear dentures, hospitalized individual and catheter users. How common is candidiasis? Candidiasis is a common condition. The most frequent type of candidiasis is a vaginal yeast infection, which affects around 75% of people with a vagina at least once in their lifetime. Although rare, serious cases of invasive candidiasis affects nearly 25,000 individuals in the United States each year. How does candidiasis affect our body? Candidiasis causes discomfort, itching and irritation until the treatment, but is not a major threat to our overall health. Like any other infection that you might get from an injury, it's best to treat the infection at the first sign to alleviate our symptoms. If candidiasis is left untreated, severe infections could spread to other parts of our body, including our blood, heart, and brain. What are the symptoms of candidiasis? Symptoms of candidiasis vary depending on the location of the infections. Symptoms of candidiasis include red patch of skin with small raised bumps, itching, burning sensation, vaginal discharge. Discharge can be white or yellow, white patches or sores in our mouth that causes loss of taste or pain when eating or swallowing, swelling or inflammation. Candidiasis infection is the result of an overgrowth of candida yeast due to an imbalance of healthy bacteria and yeast in our body. Triggers that disrupt the balance of bacteria and yeast include taking antibiotics, steroids, oral contraceptives, medicines that cause dry mouth or medicines that turn off healthy bacteria, feeling stressed, eating a diet high in refined carbohydrate, sugar or yeast. having uncontrolled diabetes, HIV, cancer, or a compromised immune system, experiencing hormonal changes during pregnancy. Is candidiasis contagious? Candida yeast can spread from person to person, but that doesn't mean it's contagious like the flu virus. If you come in contact with someone who has candidiasis, you won't necessarily develop the infection because the yeast on another person didn't change the balance of yeast and bacteria in your body. But it's a possibility that it could change your balance and cause an infection. For parents who are breastfeeding a newborn, if your child acquires oral candidiasis, that infection can transfer to you via your baby's saliva. If this occurs, your doctor will recommend treatment for both you and your baby's infection at the same time to prevent the infections from coming back. What are the diagnoses and tests? How is candidiasis diagnosed? Your doctor will diagnose candidiasis after a physical examination of the affected area. They will also ask you questions about your symptoms, including the severity of your symptoms and how long you have experienced them. Your doctor will also test the infection to identify the type of yeast that is overgrown, which better determines your treatment option. What test help diagnose candidiasis? A doctor will test the infection to determine the best treatment plan to combat the overgrowth of yeast. A culture test identifies the type of yeast and bacteria in your infection. For this test, a doctor will swab the infected area with sterile cotton, then examine the sample under a microscope. Management and treatment of candidiasis. How do I get rid of candidiasis, or how do anyone can get rid of candidiasis? After diagnosis, your doctor will recommend several different treatment options depending on the type of candidiasis you have. All candidiasis treatment involves using or taking an antifungal medication that is either oral or topical. Each antifungal medicine has specific instructions, so you have to ask your doctor. You have to ask your doctor to explain how to apply or take the medication and how long you should take it. Even if your symptoms stop early, it's best to continue your treatment plan as advised by your doctor. Can anyone take over-the-counter medication to treat candidiasis? Yes, you can take over-the-counter antifungal medication to treat your yeast infection, but the success of OTC medicine is dependent on knowing which type of yeast you are trying to treat. This can be difficult to identify without visiting your doctor. How long does candidiasis last? Most mild to moderate cases of candidiasis will clear up in 2 to 3 days after you complete treatment. More severe cases of candidiasis may take a couple of weeks to clear up completely after treatment. How anyone can prevent candidiasis? Anyone can prevent candidiasis by maintaining good physical and oral hygiene, minimizing unhealthy foods for your diet like refined carbohydrates and sugar, managing your stress, treating current medical conditions like diabetes, cancer, or HIV. What can anyone expect if have candidiasis? Treatment of candidiasis is extremely effective. Symptoms are bothersome but will start to fade after treatment begins, and infections will clear up completely between 2 to 3 days or up to 2 weeks, depending on the type and severity of infection. If left untreated, symptoms of candidiasis will cause irritation and discomfort and could increase in severity over time. Sometimes candidiasis will return after treatment, so it's best to work with your doctor on a treatment plan to target the specific type of yeast that cause the overgrowth on your body and follow through on treatment as directed. So thank you. If you like our video, please subscribe to our channel. Thank you to all.